Hello, I'm Peter Bruce. I'm a medical registrar, and I'm going to talk to you about how to do a therapeutic rocket aspiration on the chest. You will need a sterile field to start with. You will then need a chloroprep pen, lignocaine, a scalpel to make a small incision, the rocket drain itself, a blunt needle to aspirate the local anaesthetic, an orange needle and a green needle, and a 10 ml syringe, as well as sterile gloves and a tegaderm to attach the drain to the skin. You will also need a drain to collect the pleural fluid. Once you're ready to start your procedure and you've got your sterile area prepared, put your sterile gloves on, clean and drape the patient. When you're ready to continue, take your pre-filled lignocaine syringe, remove the blunt needle and place the orange needle on the end. Palpate the area and inject some local anaesthetic. Then insert your green needle. Ensure the patient has no pain. And advance and give local as you go. At this point you should be able to aspirate pleural fluid as shown here. You then withdraw the needle slightly and inject the remaining local anaesthetic to anaesthetise the pleura. Once you've done this, the anaesthetic should take good effect. Use the scalpel. Make a small incision to the chest, just wide enough to introduce the drain through. Then assemble the drain. Ensure that you know how it operates and that you're familiar with the locking procedure on the drain itself. Ensure that you're aware of the tap at the side and that it's in the off position when you start. When you're ready, insert the drain through the small incision that you've made and be ready to aspirate as you go. Advance and be aware that you may face some resistance. You can then aspirate some fluid as shown here and you'll know that you're in the correct space. As per previously shown, be familiar with the drain, remove the needle itself, keep this hand steady and with your dominant hand advance the drain into the space. You can then remove the needle and place back. You then have the opportunity to manipulate the tap itself once a syringe is inserted to gain an appropriate sample of pleural fluid. At this point, however, I would use the tegaderm to secure the drain in place once you have removed the sterile drape. For the purposes of demonstration, we'll leave this here. You can then use the tegaderm to secure the drain in place. It's generally advisable to use at least two to do this, so one should go in the other direction. As mentioned, you can then insert a syringe here and manipulate the tap to gain your samples. In the absence of that, I would insert this drain at this moment and then move the dial so so that the liquid will flow freely into the drain, as shown here.